In today's video, we're going to be talking about how your brain learns pain. If you've had pain for a little while, which tends to make things a lot more sensitive than normal. So make sure you stay tuned until the very end of the video, as I'll be telling you how you can decrease the sensitivity in your joint and improve your pain. And we're going to start right now. Now, I know it might sound pretty strange that your brain actually has the ability to learn pain. But we know that with advances in pain science and medicine, that this phenomenon is actually very, very real. It explains why things become more painful than they were previously, and potentially why you can even get pain at rest. It's actually very common in persistent pain conditions, and these are conditions that people experience for longer than 3 months. So for a lot of people, osteoarthritis would fit into that category. So in today's video, we're going to talk about how this process works, how it can make your joint more sensitive to pain and increase the pain you experience. But more importantly, towards the end of the video, we're going to touch on how you can try and overcome this and decrease the sensitivity in your joint, thus improving your pain. Now, in order to understand how this process works, we're going to have a very quick neurology lesson. Now, it works by a process called neuroplasticity. And this basically refers to the fact that your brain is a highly intelligent, complex organ that is consistently evaluating what's going on in your environment, trying to absorb this information and trying to learn new things. Your brain tends to be most neuroplastic during childhood and adolescence. And then as we get a little bit older, this process tends to slow down a little bit, which is why that age-old adage of your brain is like a sponge is actually pretty accurate. Try to think about your brain as this highly complex series of pathways and connections that are consistently communicating, talking, and sending messages to each other. When we interpret information from our surroundings, these pathways light up and they start communicating. Now, if we start to receive more consistent or similar information from our surroundings, these signals and pathways tend to light up more and communicate with each other more, which tends to make them stronger and more hardwired, if you like, so that when we receive the information next time, it's a lot easier for us to understand and compute. So as we expose ourselves to different tasks, activities, and subjects over and over, this process happens over and over. We produce more of these pathways, the pathways become stronger, and this network of connection becomes more ingrained in our brain and, like we said, more hardwired. Which explains why tasks that you do every day of the week, you often are doing completely autonomously. Do you really think about where your hands are on the steering wheel where you're driving, or consciously think about changing gear? However, if you stop exposing your brain to these situations or activities, these pathways communicate less and they become weaker. For example, when I was at school, I studied hard for my maths exams and I did okay. However, I haven't done any maths since, and if you put a maths paper in front of me now, I honestly wouldn't have a clue where to start. And the same would apply if you played sport or learnt a language at school and you haven't practiced much since. You've either forgotten a lot of it or you're probably not as good as you once were. Now remember that bit for later on in the video. Now the fact our brain is this highly intelligent, complex organ that has the ability to learn lots of different things is normally brilliant. It means we can train to be a doctor or learn how to be an astronaut or whatever else takes your fancy. But when it comes to pain and persistent pain, it's not always that positive. Now, pain is controlled by our nervous system, which is made up of our spinal cord and our brain. And our nervous system reacts to many, many different factors. It does react to physical things like changes to our joint or being overweight, but it also reacts to a lot of psychological factors like our thoughts, our feelings and emotions, and also a lot of environmental factors too. When we're in a potentially threatening situation, a signal is sent from the stimulus to our spinal cord and up to our brain. And when the signal gets to the brain, these pathways light up and they start communicating with each other. They need to communicate and decide whether they need to produce a pain response or not. And this will be based on your past experiences, what's happened to you, what you've been told, heard, or seen. So if we take a quick arthritis-related example, if you develop some knee pain and at the beginning the stairs are uncomfortable, what happens is a signal is sent from your foot to the spinal cord to the brain. These pathways light up and they produce a pain response. Then you have the option of avoiding it or pushing through the discomfort. Now the next time this happens and you place your foot on the step, a signal is sent from the foot to the spinal cord, to the brain. These pathways light up, but they now have the ability to say, hold on a second, last time this happened, it was uncomfortable. It is a potentially threatening situation, and in order to protect this person and keep them safe, we need to produce a pain response. So a pain response is produced. The more this happens, the more the pathways communicate with each other, the stronger they become, and the more hardwired and ingrained they become in your brain. And essentially, your brain becomes better at anticipating the pain. And it's this process that we're referring to when we say that your brain actually has the ability to learn pain. What can happen as this process goes on, which is not uncommon for people with osteoarthritis, is that your nervous system becomes more sensitive to your surroundings. And it starts to interpret different situations that may not be threatening or harmful to you or your joint as threatening and harmful to your joint, and subsequently produces a pain response. One analogy we often use in pain education to try and explain hypersensitivity is to try and think about your pain system like a car alarm. What should happen, if it's working properly, is there should be a fairly significant trauma in order to produce a pain response, i.e. somebody puts a brick through the window of the car and the car alarm goes off. However, if this system starts to become faulty or it's not functioning properly, then it needs less and less for a pain response to be produced, i.e. somebody knocks on the window and the alarm goes off. If it continues further, it might be that a leaf drops on the roof and the alarm goes off, and if it continues further, it might even be that the alarm just goes off by itself. And this is why in people with persistent pain, they often even find that they get pain at rest when there's absolutely no threat to themselves or their joint. If you'd like to have a look and a read a bit more about hypersensitivity and how it works, it is also known as central sensitization and allodynia, more unnecessary medical jargon. So if our system has become hypersensitive and our brain has learned pain, does this mean that we're going to be in pain forever? The short answer is no, not necessarily. Just like our brain has the ability to learn new things, it also has the ability to unlearn things, which is why I've forgotten how to do maths and you may have forgotten how to do that language or sport at school. Now, I did say at the beginning of the video, if you stay tuned until the end, we would discuss how we can decrease the sensitivity in your joint and try and improve your pain. And this is where exercise comes in. Now, if you have been given exercise or tried exercise, it's normally given to you and you're told that we need to get the joint moving and try and strengthen the muscles up around the joint to offload the joint, which is absolutely true. One thing that it can do, which isn't often mentioned when it comes to arthritis, is it can improve your confidence in your joint, which is often affected if you've had pain for a while. And the other thing it can do is it can help to try and desensitize the affected joint. Once you've been educated and reassured about how the pain process works, you'll probably be happy to work into a little bit of discomfort. And on that, we know it is fine and safe to work into tolerable levels of discomfort. What you need to do is monitor how your symptoms respond over the following couple of days. If you've got some achiness or soreness that is manageable for those 2 days that then settles down, that would be an appropriate level of discomfort to work into. What we want to avoid is a significant spike in your symptoms for a 3 or 4 day period. So if you start an exercise in a very gradual, progressive, slow way, in an environment that you feel safe in, what you will start to do is re-educate your brain, re-educate those pathways about the fact that the level of threat to your joint isn't as high as it was previously perceiving. And if you do this over a prolonged period of time, those pain pathways will communicate less, they will light up less, and they will become weaker. And this is when you will see a decrease in your symptoms. Thank you for watching. I do hope you found today's video useful. There are some more pain education videos on the channel, and there is a whole playlist on the channel to help you manage your arthritis better at home. And until next time, I'll see you again very soon.